Welcome to Holmes on Health, the podcast where nutrition, fitness, and hormones meet health span, and science meets real life. I'm Dr. Alan Holmes, a recovering emergency physician turned expert in hormone optimization, metabolic wellness, and living life fully optimized. Each week, we dive into the tools, truths, and evidence-based therapies to help you build a stronger body, sharper mind, and more vibrant life. Whether you're curious, confused, or already optimizing, you're in the right place. Thank you for being here. Let's get into today's episode. Hello there, and welcome to episode 2 of Holmes on Health. Thank you so much for being here. I'm Dr. Alan Holmes. Today, this one's for the men. We're going to talk about the truth about testosterone. However, ladies, I would encourage you to continue listening because I assume you probably know a man, perhaps your spouse, your significant other, maybe your father, that would benefit from this conversation. There's a lot of talk about testosterone today all over the social media, some good information, some not so good information, and we're going to try to clear some of that up in this episode. We're going to cover a lot today. We're going to go broad, but also at times we're going to dive a little deep to give you as much information as possible. The other thing that I would say is that in the future episodes, I will likely dive a lot deeper in on many of these topics because it is complex. We are going to talk about the basics, like what testosterone even is. We're going to talk about the benefits of testosterone. We're going to talk about what it means to have low testosterone and what that feels like. What are the signs and symptoms of that? We're going to talk about how we would even measure testosterone to know if we did have low testosterone. We're going to talk about what good levels mean, and I use that in air quotes. We're also going to talk about how to replace testosterone or boost testosterone levels. And in the end, a few practical applications and takeaways. So again, super glad that you're here. We'll go ahead and get started. First up, what is testosterone? Testosterone is a hormone. It is a chemical messenger, meaning that messenger has to travel to a receptor, like a signal, and it has to be heard and then responded to. It's produced primarily in the testicles of men. However, a little bit is also produced in the adrenal glands. It plays a role in libido or sex drive, a role in energy, mood, muscle mass, bone density, lots and lots of roles going on where testosterone is interacting with the receptors of the cells throughout the body. So, what are the benefits of testosterone? Well, as we mentioned, it plays a role in increasing lean muscle mass. It plays a role in bone density. It also plays a major role in our sex drive or our libido. It also plays a role in mood as well. Let's talk now for a minute about what low testosterone might look like in you. The symptoms can be variable from individual to individual, but here are the most common ones: fatigue, brain fog, low libido, erectile dysfunction, changes in mood, which can be either depression or anxiety or irritability. These are all quite common for men suffering from low testosterone. So let's say that some of the things I just said, wow, that sounds like me. I think I have some of these symptoms of low testosterone. What should you do next? Well, the next step would be to get the levels tested, right? Well, then how do we go about that? And what levels are we supposed to test? The first answer I'm going to give you is that of the American Urologic Association. They have very specific guidelines on testosterone testing. In order to diagnose low testosterone, according to the American Urologic Association, the blood needs to be drawn in the morning between 7 a.m. and 11 a.m. And it needs to be drawn on 2 separate occasions. Of those blood draws, the total testosterone level needs to be below 300 in order to qualify for their diagnostic criteria of low testosterone. The other criteria is that you must also meet the symptoms of low testosterone as well as have the low number in order to qualify for the diagnosis of low testosterone. The range of testosterone is an interesting historical story. The current range, and I'm going to go with LabCorp, although there's other lab like Quest and many other labs out there that have slightly different ranges. Currently, the range of total testosterone on LabCorp is a low of 264 and a high of 916 nanograms per deciliter. The interesting factoid about this is that in 2017, these numbers were changed. Prior to 2017, the low was 348 and the high was 1,197 nanograms per deciliter. These were with men greater than the age of 18 as well as a BMI or body mass index less than 30, meaning they did not test the blood or include the blood levels of men that were considered to be obese. Now, one might question, why did they change the range? Did we suddenly need less testosterone here in 2017, 2018 than we did prior to this? Or was there some other explanation? The explanation that the LabCorp gave was this: that having done a study testing the testosterone levels of many, many men, they discovered that the range or the average numbers were declining. And so therefore they changed their range to match the population. Now, I'm not sure this makes complete sense, because if they're not saying that we need less testosterone than we did decades ago, why would they change the range so that the numbers still look normal? That doesn't make much sense to me. And it leads me to another point too, is that what are they actually asking? Or maybe the better way to look at it is, what question are they answering? They are answering the question, what is the normal range of testosterone for the average population of men? Not the healthy men, not the men with no medical problems, not the men on no medications, just the average population. That's the answer to the question. However, I think it's the wrong question. The question I think we should be asking is, what is the average testosterone level or range of healthy men that are vigorous, strong, happy, great libido? Those are the numbers that I want. And if there is a safe and effective way to achieve such numbers, then I would be interested in that too. And so we're going to get into that. So let's say that we have symptoms of low testosterone and that our levels read low. Again, not low by the LabCorp range, but read relatively low and our symptoms match. When LabCorp created their range, what they essentially did was tested all these men. Then they took an average of those numbers, and then they went out 2 standard deviations, and they called that the new range. So if we're looking for a range of the healthy, vibrant, full of vigor men, what does that range look like? And I'll be honest with you, there aren't great studies on this. It hasn't been tested. But what I can tell you is that after looking at thousands and thousands of lab tests and treating hundreds and hundreds of men, you start to get an idea of the numbers that match the symptoms. And so what I would say is a free testosterone level of 18 to 22 is probably pretty good for the average guy that's making his own testosterone. Now, when we go to replace testosterone, we usually have to get to levels a bit higher than that, maybe a free testosterone level of 25 to 30, in order to achieve the clinical outcome that we're looking for. Now, if you're listening closely, you just caught me, because I said free testosterone, not total testosterone. Let me explain. Total testosterone is what the American Urologic Association bases their diagnosis and therapy on. However, I believe that the free testosterone is a much more applicable number. Why is that? You have a total amount of testosterone in your body. Much of that gets bound up by what's called a sex hormone binding globulin. And what is left over is the unbound or free testosterone. That's the testosterone that really matters, because that is the testosterone that goes into the cells and interacts with the receptors and does all the things that we want testosterone to do for us. So let's say that we now have relatively low numbers and we're symptomatic. What next? Well, the next question may be, well, are there natural ways in order to boost our testosterone levels? And the answer to that question would be yes. Some ways to do that are zinc, boron, optimizing vitamin D levels, getting good sleep, lifting heavy weights, avoiding alcohol, which tends to lower testosterone levels in both men and women. This is not an exhaustive list, and there are other things that could be thrown out here as ways of boosting the testosterone levels naturally. But I'm going to save that for another episode. And for now, I'm going to move forward with other pharmaceutical interventions. There are ways to boost testosterone levels without giving testosterone. These are medications like enclomiphene or clomiphene or HCG, human chorionic gonadotropin. I'm also going to save those for another episode because it's a longer discussion than we have time for here today. For the sake of time, I want to give an overview of testosterone replacement therapy, or TRT. Testosterone replacement therapy has been offered for decades, At times it's been in favor, at other times it has been vilified. It seems that it cycles between being heralded and being vilified. And sometimes both are true at the same time. I prefer the term testosterone optimization. And why is this? Well, rarely is the patient going to have no testosterone at all and therefore need to have the testosterone replaced. In most cases, their levels are low and they're symptomatic. Therefore, the testosterone levels need to be optimized in order to improve symptoms and quality of life. So when we talk about testosterone replacement therapy, what I'm actually talking about is testosterone optimization. In my opinion, there are three viable ways to administer testosterone: injections, pellets, and creams. Notice I did not mention oral testosterone. It is true that it does exist. However, my reading of the literature does not give me the confidence to prescribe it at this time because I do not believe that it is necessarily safe. And I'm also not sure that it is a administration in which optimal levels can be achieved in order to obtain an improvement of quality of life and symptoms. So I'm going to briefly go over the three that I mentioned, the three that I offer in my own practice. The first of which of these is injections. Now, this would either be an IM injection, intramuscular, or what is known as a sub-Q injection, which is an injection with a smaller needle just under the surface of the skin. These injections can be done once every 2 weeks, or once a week, or twice a week, or even more frequently than that. It is given in the form of testosterone cypionate or enanthate. Those are the two most common. The cypionate and the enanthate are called esters. Essentially, they aid in the delivery as well as the duration of action of the testosterone. What's the biggest advantage of testosterone injections? Well, they're potent because they're injecting right into the system so that you get very good levels. It only has to be done maybe twice a week. I would say that would be a minimum. Oftentimes our patients are on there much more frequently than that. What are the disadvantages? Well, it's a needle, and some people don't like needles. And for them, testosterone injections would be a non-starter. The second disadvantage, in my opinion, is variability of level, meaning there are peaks and troughs. Let's say that you are going to do an injection twice a week. Let's throw out Monday and Thursday. Well, your levels are going to be significantly different on Monday, Tuesday, into Wednesday than they are by, say, Wednesday evening when it's almost time for another injection on Thursday. Sometimes these peaks and troughs can lead to the patients becoming symptomatic throughout the week. In those cases, I would recommend they inject more frequently. The second option is pellets. Now, this involves a small procedure where an incision is made in the gluteus or the butt cheek, and a device called a trocar is inserted, and through that trocar, pellets that are about this little larger than a grain of rice are inserted into the tissue. After they are inserted, you put some steri strips on, and that's the end of the procedure. The pellets then get slowly absorbed into the bloodstream, raising the testosterone levels. Usually this procedure needs to take place, say, every 3 or 4 months, depending on how you metabolize them. So what are the advantages? Well, the biggest advantage is it's kind of set it and forget it. You show up, you have your pellets put in, nothing for you to worry about for the next 3 or 4 months. And what are the disadvantages? Well, once those pellets are in there, well, they're in there. And if for some reason the dose isn't agreeable to you, there's no way in which to extract the pellets. And so there's a little bit of guesswork in some cases as to exactly what dose of pellets one patient may need, because we don't know exactly, particularly if they are a new patient, the testosterone levels, which is going to allow them to achieve the results that they want. Secondly, it is a minor procedure and does require a bit of minor downtime. Mainly, you shouldn't be in baths or waters or hot tubs or oceans for about 5 days after the procedure. And secondly, you shouldn't be doing any strenuous activity, particularly like squatting and that sort of thing, for a few days, because you want to give a chance for the pellets to seed. The third, last but not least, and I'll put all my cards on the table, my go-to form of testosterone replacement therapy, and that is creams. When I say creams, I am not referring to things like androgel or other commercially available testosterone. I am referring to testosterone that is compounded at a quality compounding pharmacy. This testosterone is applied usually twice a day, occasionally once a day. It is applied to the scrotum. Why the scrotum? Because it's thin skin, lots of blood vessels, very, very good blood levels. This is why it is significantly different than an androgel or other commercial product that you may apply to your arm or your abdomen or your shoulder. The reason that I like testosterone cream the best is because one, it gives the most consistent levels. Because you are microdosing twice a day, it is what mimics your body's own production the most. Two, it is very, very easy to lower and or raise the dose just by the number or the amount of cream that you're using. So let's move on to side effects. Like with anything else, with any medication, there's always potential downside. So let's go through some of that now. The first is acne, or what I would call folliculitis. Some people call it back acne. This is because when you're on testosterone replacement therapy, you tend to produce more oil. That oil can therefore harbor bacteria, which can lead to some acne or to some skin infection known as folliculitis. This is not super common, and if it does happen, there are ways to address it. Lots of guys worry about hair loss with testosterone replacement therapy. And to be honest, there's not much of a concern here. In the studies that look specifically at this, where they primarily saw the hair loss were with men that were already losing their hair, already had male pattern baldness, and the loss of follicles was about 1% more than the control group, meaning the group that was not getting any testosterone. So it's not a big issue. Number three, as far as side effects, it does decrease the size of your testicles a little bit. We are giving the patient testosterone, therefore the patient no longer needs to make their own testosterone, which is, again, as I said, is primarily made in the testicles, so the size of the testicles do get a bit smaller. The fourth is, and kind of along the same lines, it can cause infertility, and theoretically that infertility could be permanent. So men that may have symptoms of low testosterone and even may have low testosterone levels should pause and strongly consider their future desires for children before they would ever consider going on testosterone replacement therapy. They should perhaps look for one of the other modalities of boosting testosterone numbers, whether that be natural or whether that be medications, as we discussed in clomiphene or enclomiphene. The next one I'll mention is a rise in hemoglobin or red blood cells. We all have red blood cells in our body, and when you go on testosterone replacement therapy, it tends to raise the production of these red blood cells. Now, I'm going to do a special episode dedicated just to this topic, but what I'll say now is that the concern over a rise in red blood cells is largely blown way out of proportion and misunderstood by most providers. So we're going to take a deep dive on that in a future episode and clear up all of the misconceptions. This is not an exhaustive list. There are other potential side effects. Maybe it affects some people's mood. Maybe it affects some people's blood pressure, although in a very small amount in those studies. But I wanted to give you an overview of the most common things that tend to come up or that we become concerned about. So the last thing I want to mention here is who should consider testosterone replacement therapy. Well, one, it should be someone that has symptoms of low testosterone and have lab numbers that match those symptoms, meaning are relatively low. The second is that the person needs to understand that testosterone is not a magic potion. There's a lot of stuff going on the internet right now about take your testosterone shot and have six-pack abs and, the sex life of an 18-year-old. It's not like that. And anybody that says it's like that, they're not being genuine. As my colleague Keith Nichols says, who's a brilliant provider and hormone expert in Tennessee, owner of Tier 1 Wellness, he says testosterone rewards hard work, and I could sum it up no better than that. It is a piece of the puzzle, an incredibly important piece of the puzzle, but it's one piece of the puzzle. It goes along with strength training and nutrition and good sleep and good supplements and controlling stress. It's one piece of the puzzle, but what it does is when you're doing all those other things right, it's going to reward your hard work and discipline. The next thing I would say is that, and I've already mentioned this briefly, the person really should probably not desire to have any kids in the future. Although it is possible that the infertility doesn't happen at all, or it's possible that even if they were infertile, they could go off of testosterone replacement therapy and have a return of their fertility. There are no guarantees with this. And having children is a huge, huge life decision that not only affects you, but also affects your spouse. The last thing I would say about who is testosterone replacement therapy for, it's someone willing to play the long game. someone that understands that it doesn't work instantly. It's not instant gratification. And as I already mentioned, it's someone that's willing to work on the other facets of wellness, meaning nutrition, sleep, exercise, and the like. So that's it for this episode. I really appreciate you tuning in. I really appreciate you hearing me out. I hope this information was informative, was beneficial to you. I hope that it maybe cleared up some of the questions that you may have had about testosterone replacement therapy, or maybe even cleared up some of the misconceptions that you had. So if it was helpful, please let me know in the comments. If there's questions I didn't answer, please include those as well. I promise to include the answers to those questions on a future episode. And please, if you found it helpful, subscribe, click the bell, and share it with a friend that you may think would also benefit from this episode. For now, and until next time, I sincerely appreciate your time, and here's to working together to live life optimized. Take care. Thank you for tuning in to this episode of Holmes on Health. If you found today's episode valuable, share it with someone you care about. And hit subscribe so you never miss a future episode. Want to get more of our content? Follow me on Instagram and YouTube at Alan J. Holmes MD. Until next time, here's to living life optimized. This podcast is for general informational purposes only and does not constitute the practice of medicine or other professional healthcare services, including the giving of medical advice, and no doctor-patient relationship is formed. The use of information on this podcast or materials linked from this podcast is at the user's own risk. The content of this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Users should not disregard or delay in obtaining medical advice for any medical condition they may have, and should seek the assistance of their healthcare professionals for any such conditions.